Hello, everyone. Welcome. My name is Jackie Zimmerman. I will be moderating this amazing international roundtable. I'm a long-term UC and J-pouch patient myself, and I'm excited to introduce you to some of my friends. Before we dive in, I wanted to talk a little bit about the Galley Health app and why it's so cool. And Galley Health is the host of this whole shindig tonight, so I felt like we should talk about them a little bit. Galley Health is a free app and it's designed specifically for IBD patients, and it uses artificial intelligence to help you on your specific IBD journey. You can ask Galley questions about IBD. She can serve up some answers and resources for you. And right now they have a COVID-19 specific feed in the app, and it provides accurate and up-to-date information for IBD patients. So be sure to check out the app, ask Galley a few questions, get your personalized info, and it's a really great resource. You should definitely use it. And it looks really cool. I don't know if you can see it, but Galley looks very friendly and she knows everything. So it's definitely a great place to start if you're looking for information. We had a roundtable like this a couple weeks ago with some of our friends from around the world, and it was enlightening, to say the least, to learn what's happening in different countries and how they're tackling COVID-19, but more specifically, what patients with IBD are doing, what information they have access to right now, and what their healthcare providers are telling them to do. So we wanted to do it again. So here we are again. We have 4 new lovely people from 4 different countries, and I would love to do some quick introduction. So tell us who you are, where you're from, and if you're city, province, state, country, and how you've been spending your time in quarantine or lockdown, or if you haven't been quarantining, what have you been up to? Let's start with Yannick.
Good morning and greetings from Estonia. I am a Crohn patient. I have Crohn disease from 1996, and I'm also founder of the Estonian Crohn Colitis Association. So I try to make IBD patients' life in Estonia a little bit better. So to come back, today's topic will be in self-quarantine since 12th of March in Estonia. Also, the Estonia is in lockdown from the March 12th. So doing homework, learning with my son, managing the other son with kindergarten stuff, and the smallest one just wants also entertainment all the time. So actually nothing else to do, pretty much. Full day job.
Just you've been handling 3 kids for a few months. That's what you've been doing.
Yeah, it's crazy. And we are living in an apartment, so you can imagine.
Yeah.
We are going outside only when there is nice weather, because we are afraid to get flu or something, and then we get some symptoms and don't know, is it COVID-19 or is it just flu or something. So we try to minimize the risk of infection.
Yeah. Whew. I feel for you. I don't have children, and I can only imagine what it's like right now, especially with multiple children. I have 4 animals, and I feel like that's hard enough as it is. So kudos to you.
Let's swap them.
Yeah.
Let's change that. I will take the animals for a week.
Let's hear from Maladi.
Hi guys, I'm from Malaysia. So I have ulcerative colitis. I've been diagnosed for about 3 years. So in Malaysia, we have been on lockdown, or something called movement control order, where we're all asked to stay at home, work from home, and go out only when necessary, if we have to buy like groceries, or maybe if we need to go to the hospital, etc. So it's on day 43 over here. I've been spending my time working. I'm more into digital marketing. So now with everyone going digital, I've been really busy. So yeah, it's been good. And my free time, I just work out if I can in my apartment as well. So I feel like a hamster running around my apartment. So that's how I've been spending my time.
You're definitely doing more than I am at that point. You lost me after working, and anything after that is just Too much, too much. Luke, what's your story?
Hello, I'm Luke Escombe. I'm here on Sydney's northern beaches in Australia. It's about 5 o'clock in the evening. I've had Crohn's disease since I was 14, but had an ileostomy about 8 years ago, and I haven't, very fortunately, haven't had any symptoms to worry about since then. I'm an ambassador for Crohn's and Colitis Australia. I did a musical comedy show about living with Crohn's disease back in 2011 that sort of took me around the world and started me performing at a bunch of sort of health conferences and things like that. What was the question? Oh, so yeah, no, what have I been doing? I was going to be doing a new album and was starting gigs just as the lockdown period started. And then there was a really difficult transition period when I realized, okay, so I've got no work now for the rest of the year. And then they shut the schools. And then I just started to focus on living day to day. And I've got a 6-year-old, now 7-year-old actually, he just had his birthday last week, 7-year-old boy. And I've just been really enjoying homeschooling and spending time with him. And doing some live streamed concerts and learning how to move my teaching online. And now the restrictions are starting to be relaxed a little bit in Australia as well. So I don't know, it's been a very volatile sort of situation. It changes every day. I'm not sure exactly when our lockdown started. It seems to be, we're the schools, some schools have gone back. So yeah, but I like being at home. It's my favorite place to be. So, and I live 10 minutes walk from the beach and the weather's been absolutely perfect. So I really can't complain. It's been quite nice.
Luke, I think you might be the only parent in the world though that just said that they really have been enjoying homeschooling. I'm not sure many share that sentiment with you. Aisha, what about you?
Hi, I'm Aisha. I am originally from Bangladesh, but I live in Saudi Arabia. And the situation here, well, it's been on lockdown, plus we have a curfew for a while now. So we can't go from area to area or like city to city. There's a travel ban and we have a curfew currently it's from 9 to 5. So if anyone breaks the rules, you get a fine. And yeah, it's been pretty like stuck. We're just like, locked up for a while. It's been going on for a while and it's just like we really want it to be over already. But yeah, other than that, I've been up to really not much. Just I'm an artist, so I like make art and keep myself busy with whatever I can so we don't go crazy.
Right.
Yeah, that's pretty much it. Yeah.
So Luke, you mentioned a little bit about the restrictions starting to lift, and we're seeing that here in the States too, in pockets and being done very differently in different states. But so I know it might be hard to speak for your country as a whole, but are you starting to see the restrictions lift? And if so, like, is it going slow, or do you feel good about it? How do you feel about it?
Yeah, I don't know. I think there's definitely mixed feelings about lifting the restrictions here. We have states as well. We have 5 different states and they are kind of doing their own thing. But here in New South Wales, the general sort of instructions is that schools can reopen 1 day a week from week 3 of term. Although my local school that my son goes to he's already going back 2 days a week. Some parents are just not into that idea at all. The government's just released an app, the COVID Safe app, a couple of days ago, which it's encouraging people to download, and it's hoping to use that to trace any contacts to sort of monitor the spread of COVID in the community. But in terms of our actual statistics, I mean, I saw that I think we had 1 new case yesterday. It's a very small number. Most of the bulk of our cases came from well, cruise ships and flights, you know, things coming into the country. There hasn't, so there have been some big pockets, but not an enormous amount of community transmission. So I think from Friday, we're allowed to have people come and visit us at home, which feels like terrible amount of social pressure, like to actually have people round to the house. I mean, I'm not sure I'm ready to see people. I mean, but the thing is, like, I'm an introvert anyway, and I don't really have a lot of work, so I've got no reason to leave the house, or particular desire to. So I don't know. It's a weird feeling at the moment. We don't really know whether, like, it feels a little bit like maybe we've beaten it, we've done it, but at the same time, we know that a second wave, like with the Spanish flu, the second wave was much worse than the first, and we don't want to be too complacent. So it's still a bit of a limbo, but they've changed where the bar is.
Right. I'm also an introvert, so I feel you. I've actually enjoyed, you know, avoiding people on walks and not having to feel like you have to small talk with everybody you see. So I'm going to miss that part of lockdown, definitely myself.
Yeah, I like the few times I have been with people, I don't have to worry about, like, do I kiss this person on the cheek or hug, or is it like a kiss and a hug? It's just an air high five, and I'd like to keep that, to be honest.
Great. Yannick, are you seeing restrictions? Because for a while, weren't you guys one of the countries that you weren't actually allowed to leave, except, I mean, like, leave your homes at all, or was that somewhere else?
No, we actually can leave, but we cannot go to one island, the Saaremaa. This one is locked. So who is in Saaremaa is in Saaremaa, and that's it. Only yesterday they were starting to talk about lifting it, so they actually can come to mainland. But other than that, we can drive all Estonia, wherever you want to go. But we have the 2+2 rules, that 2 people's 2-meter distance, or 1 family members. And police and local police and everyone is cruising around and checking. And they are even making fines when you breaking these rules. And actually, next week, they are thinking of lifting the restriction, because we have only last 24 hours 13 new cases. So it's a pretty small number comparing the previous weeks. And they are thinking to open the big malls around 11th of May. But it's still 2 meters, 2 people rules is staying, and you have to use the mask, and you have to have the disinfection in the shop. And they are actually scared because, like the Luke's told, that if the second wave is coming, they don't want to open everything and then go back and be even longer lockdown. So we will see next week what's going to happen. But the schools, I don't think they open this year, because if they open for the older classes, like the high school part, but not the smaller one, because no use.
No relief for you.
Yeah, no. So it's just waiting every day. You can have news, what's going, no one knows.
Yeah, it is still changing every day, it feels like.
And so also the neighbors, we can, I think we can go out to, let's say, like Finland or some other, but if you go to other neighbors' country, they just put you lockdown anyway. So there's no point of going there. Because the planes are still flying, and I think you can go outside, but it's risky. You cannot come back probably.
Yeah. I don't even know right now if you leave, if you can come back. I mean, not that I'm worried about traveling, but I have no idea. Melody, what are they doing are they lifting anything?
So for Malaysia, it's in different phases. So they update us every 2 weeks. So at the moment, we are on our 4th phase, and the restrictions are being lifted slowly, but it's still, we can't move out of our houses. And just like what Aisha said, there is also a fine imposed if you do travel out for no reason. But one thing that they are doing, like now, when you're going to the grocery, it could only be one person in the car. So now recently they have said that, okay, now 2 people can go. And even myself, I live in PJ, and my hospital is in Subang, which is a different state. So like, what do you call that? Sorry, a different city. And so if I have to go there, I have to actually bring a letter to say that, okay, I need to go to my hospital to get my medication and things like that. So now they have said, like, if you want to go to the hospital, there can be 2 people in the car. So in that sense, things are being more lax. But I think in terms of going back to work, it might take a while from that, because now we have about 1,700 active cases, and the government had said, the Ministry of Health said that they will look at 6 different aspects before they decide whether they want to let us go and, you know, not be under this movement control order. So they said that once the active cases goes to about 1 digit, then they might start considering to remove the movement control order. Also now is Ramadan period here, and also like with Hari Raya, and you know, it's a very big festive season here. So a lot of people would want to go back to their hometowns, and that is not allowed at the moment. But what they've done is students who are living in the dorms, so they are slowly allowed to go back to their houses in batches. And can you think of like the student being stuck in one room? You know, a lot of them are stuck in one room, and you know, they're probably going crazy as well. So yeah, so that is slowly some things that they're trying to relax. But I think in terms of letting the movement control order stop completely, it will still take some time.
Do you think it's ever going to go back to just like normal, or you can go wherever you want, whenever you want, with whoever you want?
I think it's going to take like quite a while, even in like having events, live events is such a huge thing. But even the government has said, like, you know, we can't have events for like the next actually 6 months, but it looks like the next year or so. You know, things like going to the cinema, you know, it's things that you are in close contact with each other. So it's going to be very, very different. And you know, like what Luke says, maybe we'll start air high-fiving everyone after. Yeah, but in terms of that, it's going to definitely take a while before we get back to normal.
Aisha, are you still on full lockdown, or are they lifting?
Well, so far they've it's still on full lockdown, but the only difference is they're starting to open malls, because everything's pretty much closed except the essential groceries. So they're opening up malls for people to go shopping. But other than that, like, you can only go to the mall within the area. So I wouldn't be able to like leave the area, like even for hospitals and things like that. We'd have to, like, I live in a city called Tehran, and the hospital I go to is in Dammam. So for that, we have to like fill out a form on an app and then get an approval. And once we get the approval, we get a certain amount of time to go to the hospital and then come back. But yeah, other than that, it's on full lockdown.
Where I live, it's really bizarre because they're starting to lift some things, but they then added in some others. So now you can't go anywhere without a mask now, but you can go golfing if you want to golf. So good news on that one. Yeah.
Yeah, I mean, the malls, even though they're opening up the malls, there's quite a few rules. Like when they enter, there'll be like general screening, and like you'll be handed out masks and gloves. So yeah,
It's a very strange new normal.
It is. It's like you can't go to the mall normally anymore, you know? You just gotta go in masks and gloves.
Yeah. Well, and where I live, it's almost spring. We tend to have like a late spring, and it snowed 4 days last week, and everybody was very angry that they could not go on their boats last week. So this week you can go on your boat. You know, whew, how good, considering it's only been like 45 degrees outside, but whatever. So last time we did this international roundtable, we talked to Nikhil, who was from India, and it was really interesting talking to him because what doctors are doing and patient access to care right now and patient access to information was very limited there in terms of guidance that they're giving IBD patients right now. So I kind of wanted to ask you guys, you know, what are your doctors telling you right now? Are they giving you information? Are they saying stay in your treatments? Are they like, it's a free for all, figure it out? You know, because there's part of this too that I actually kind of want to weave these two questions together, where there's a lot going on in a lot of your countries, you know, in terms of stigma or cultural opinions of living with IBD. And I'm wondering if, you know, doctors talking about this publicly and other people talking about this publicly, plus potential for cultural stigma, you know, is it been harder to get access to care, or is everybody just pretending like nothing is happening? You know, I know that was like a very long question, but we'll start with Luke and give all of you some extra time to chat.
Sure. Well, you know, on a personal level, I haven't had to talk to a doctor since COVID started. I've seen that the Gastro Society of Australia and Crohn's and Colitis Australia have shared a bunch of guidelines about not stopping your medication, don't stop any treatments, get the flu vaccine if possible. But I know that one thing we've had here is we've had a triage of endoscopy procedures. So if you have a non-essential endoscopy, like something that's exploratory or something that's elective, then you were advised not to get it, or it just wasn't happening. But that's changed recently. I think a few days ago, or maybe a week ago, they've relaxed the restrictions on elective procedures, so you now can go ahead. I've been kind of looking at the support group sites that I'm on online and just sort of seeing what people are saying. I've seen, and it's very hard because really it's all anecdotal at this stage. There's not a lot of good data, and so many people just don't talk about their IBD full stop. So, you know, you don't know. But I've seen some people whose operations have gone ahead, some people's who've been postponed. I've, you know, ostomy operations being postponed. I know, I don't know what's happened with infusions that require you to go into hospital. I know that in China, they stopped those. I'm not sure here. One thing that, I mean, in terms of actual hard data, it's been quite well documented that there's a lot less people visiting hospitals and general practices, you know, seeing their local doctor and going to pathology centers to get tests. I've seen estimates up to, you know, 44%, 50% drop. So, you know, I mean, that's obviously a very significant drop. So that may mean that people aren't getting diagnosed who would be getting diagnosed in this period because they're afraid to go to hospital, they're afraid to leave the house, or they're worried that they'll be burdening the system. It may be that people are not having tests that they themselves deem non-essential, and because of that, they might be more liable to have flares. But yeah, it's really quite hard to know. I mean, that's the one major statistic I've seen in this time that makes me think there's probably going to be some consequences from this.
I kind of thought the same thing because, you know, it's almost like the stats have been bragging that, you know, hospital admissions are down and ER visits are down for non-COVID related things. And I think that just means people are, you know, having their heart attacks at home now and not going in to get them. I think you're right. There's probably going to be some long-term consequences for people not getting care when they needed it.
I think people are either scared to go in because they're worried they'll catch COVID, or they sort of feel that their health problems are not that important and they don't want to burden the system. And I mean, both of those kind of mentalities are quite common with IBD, you know, just fear of leaving the house generally, but also this idea that really it's not that much of a problem and you can deal with it yourself and you don't need to go and get help at this time because there's more serious things. So I mean, looking at that number, it just seems a safe bet to assume that that kind of thinking is going on for a lot of people.
Yeah, I think you're probably right. Melody, what about you? Because you know you're a woman in a country that I feel like probably doesn't talk a lot about stuff like IBD, right? So are people talking about how to get care right now, or is this, what's the word?
So I think in terms of in Malaysia, perhaps there's more lack of awareness in terms of IBD itself. And like you mentioned, there is also a stigma for the people who do have it. Maybe they might not be as open to talk about it in terms of sometimes they could be judged in their workplace or even among family and friends. And which is why me personally, like I use my Instagram platform to really showcase like every single thing that I go through throughout my whole journey, because I think it's so important. And for me, it's more coming from a space that perhaps someone might not even know that they have IBD. And like, even for myself, like, you know, when I first got it, I had no idea what IBD was. And, you know, so many times when I was first diagnosed with ulcerative colitis, that they thought that I might have like piles or something, that it was like bleeding. And, you know, we were just trying to figure it out. And then finally, when I found out what it is and like, you know, what are the whole like symptoms and things like that. So then I got more aware and I wanted to share that with a lot of other people. A lot of, I'm part of the support group, Crohn's and Colitis Malaysia support group. So I think that's very important because I see a lot of people asking questions and, you know, finding out from each other. So I think that is, that's an important thing for more people to speak up and, you know, to actually share their journey. And it's okay because you might be able to impact others. In terms of the healthcare in Malaysia itself at this point, like I myself was supposed to see my doctor last month, but I didn't because it was just a normal follow-up checkup. So I didn't really see the need to actually go and see my doctor, except go and take my medication because I'm on daily medication. So yeah, I think it's a lot about awareness, and then in terms of the healthcare at this point, it's more in terms of like whether we really need to see the doctor at this point. That's the same thing, you know, it's at the back of our mind, because when we go into the hospital, we'll be exposed in that environment as well. And you know, it's just reducing the contact with more people.
Yeah, we had a live chat with Dr. Nandi, who's a GI out of Pennsylvania, and he was saying that doctors are reassessing sort of these required tests. You know, do you really need a blood test for this? Do you really need a scope for that? Which I thought was great, because sometimes it feels like we're just there all the time giving blood or getting tested, you know, over and over. And sometimes it does feel, I think they do it to, you know, make sure they cover all their bases, but it doesn't mean it's always necessary. So it's been kind of nice to see them maybe reassessing some of the way they do things. What about telehealth? Are they doing telehealth there?
Not really, but they have several apps and several services where you're able to, like, you know, chat with your doctor online and things like that. So there are a few ways, but even in my case itself, because it was a follow-up, I think like maybe if I was in a flare, and I was in a flare towards the end of last year, and I was going to the hospital every week, and, you know, like you said, getting tests, getting like scopes, getting checkups, and, you know, my medications were changing so much. So maybe that time I would be more, okay, I need to go to the doctor no matter what, I want to see. But now, since I'm better and things are on control, so even I assess for myself like, okay, it's not really necessary at this point. Yeah.
Aisha, what's happening in Saudi Arabia?
Well, over here, I mean, generally the doctors recommend to continue all your meds and, you know, don't stop anything. But, well, we don't really get to hear much from them. I mean, because I think it's legally not allowed for anyone other than the government to update us on situations. So we don't really hear much from them, other than, like, you know, how to maintain it, how to control it, how to stay safe. And yeah, the doctor-patient relation is very different over here. I mean, it's pretty conservative, like everything. But other than that, like, we're told to take our medications. So the hospitals, like, if you're prescribed anything, like you said about telehealth, so we have that. So if you set up an appointment with a doctor, they'll call you, and if they prescribe any medications, it'll be delivered to you from the hospital, depending on where you live. But if it's like, not all medications are delivered. Like for me, if I was prescribed narcotics like a week ago, but for narcotics, I have to go in personally and pick it up because of how controlled it is. So, I mean, it's been tough. It's been challenging.
With doctors not being able to give official information where you're at, are you finding you're going other places? Because like, for instance, the American GIs that are on Twitter have been just phenomenal, giving out information and sharing research that they're doing in the database they're working on of COVID patients who have IBD. Have you found that you're seeking information elsewhere, or are you just kind of
Oh, yeah.
taking it in stride?
Oh no, definitely seeking information elsewhere, because I mean, it's been a struggle to really, like, you know, keep in touch with the doctors. Like, even if you have a telehealth appointment, like I had one about 2 weeks ago, and it, like, I explained what I was going through to the doctor, but he kind of like just prescribed narcotics for me. So that's, you know, a little tough to just maintain the pain. But what I actually, because I have Crohn's disease and I have an ileostomy, and I had a complete complete proctectomy last year. So I mean, I still have my stitches in from surgery. It's been like 9 months already, so it's been pretty crazy. Yeah. So I mean, I think, well, because of that, on my Instagram, I like post on what I go through, and I get help from other patients and advice. So right now I'm having appointments in the US with physiotherapists. Yeah.
Wow. That's,
Yeah.
I didn't think about that. Yeah, your access to care is kind of bigger right now if you can make appointments with people in telehealth everywhere. I never thought about that.
Yeah.
Are you on your Instagram, are you finding that, you know, the people around you or your family or your friends, that they're supportive of you kind of sharing your story on Instagram?
Well, my family is supportive of me, like my direct family, like siblings and my parents and stuff like that. But I mean, it's I come from a culture where things like anything relate, you don't really share your health problems. You don't really just go out there and, you know, talk about what you're going through. But in my case, I was like, you know, it took me a while. I've had Crohn's for 14 years now, since 2006. And I just made my Instagram last year. So it's been tough. I mean, I wasn't able to go out there. I've been following people with my regular Instagram account and looking at other patients, but to go out there and talk about what you're going through, it's very difficult, especially knowing that it's not something that's, you know, practiced in our culture. It's not, like, yeah.
Is it health issues in general, or more like specifically with UC due to like the nature of the disease?
Yeah, it's not all kinds of health issues. It's mostly, yeah, like the you know, Crohn's and things like that. Things that'll embarrass you that,
Right.
you know.
Yannick, what's the cultural feeling about IBD where you're at?
Actually, it's something similar like Aisha has, because in Estonia we are a small country, and most of our association members don't even talk publicly about this. I can make one example that one member pays a membership fee cash, so it's not leaving any trace that is in our association. So you can figure it out how embarrassing it's to have, because if you start talking, then everyone knows wherever you go, try to apply to work, everyone will Google you, it will come out. So it's like, we don't take this person because he has this illness. It can be like this. I'm not telling it is, but it can, and the people are afraid. And the same thing is because it's like a invisible illness, and it's like this who want to talk about who stuff. So you keep it to yourself, and if you come out, then everyone knows, especially when you live in a small town or village, then all neighbors know, and probably they don't want this to happen, so they keep mostly to themselves. But our association been active 5 years, and now I'm seeing 2, 3, 4 people coming out, so it's actually a good sign. We're doing the right thing.
It's been really interesting getting to know you over the last year, because hearing you talk about that, of, you know, how small your, like, the organization is, just because people don't want to talk about it, and hearing that it's slowly starting to grow and people are becoming more comfortable with talking or just participating or helping push forward research. Like, that's, I mean, you guys know here in America, we'll talk about anything too much. We'll share too much information all the time. So it's been really good for me and interesting to hear about other places where that's not really the case, because I am a chronic oversharer of information, and that's part of why we're here. But I know that it's not like that everywhere, and sometimes it can't be like that. What's the situation with healthcare and hospitals right now, Yannick? Is your healthcare system based on like an old kind of Soviet thing, or are you guys, is it different?
We have public health hospitals, and we have the private, but most people go to the government hospitals. But from the lockdown, they actually cut out the family doctors. We cannot go directly to them because they are saving them just in case the hospital staff is getting infected. So we only can call to family doctors. We can even take electronic sick leave. We log into online page and make one for ourselves, so it's new thing, and then the doctor will confirm it. And the IBD doctors also make phone calls. I had myself an appointment, and in the morning I sent the SMS that I'm not coming to the hospital, that it is dangerous, and I am in a risk group. So just to inform him. But 2 hours later, he called to me and said, "Oh, we are now doing the telephone thing." I said, "Okay," but I was surprised. I had no info. Maybe I wasn't answering. It was a number I didn't knew. So I just, okay, let's pick it up. But it should have been like informed that we are going to do this, but
Right.
It's new thing probably. And I think from next week, they are also lifting the ban that the hospitals are starting to work normally, because till now all major surgeries and everything that is not life-threatening were cancelled. At least this is the information I have.
Mm-hmm.
So
does the restriction lifting make you guys nervous? I feel like I hear about like going to malls sounds terrifying to me, or you know, some of these, and I think that just it's the sign of the times. But I think it was Melody talking about concerts and things of, you know, even once everything is lifted and you could go back into the world, would you? It's, I don't know, it's such a bizarre thing because I do think that there's a pretty high likelihood of a second wave, you know, just based on research and history of what we know of how these things tend to work. And frankly, how people act here. I mean, have you guys had protests in your countries about the lockdown, or is that just us?
No.
Not like yours. My goodness. You guys are protest about anything. It's amazing.
No, I know. It's so embarrassing.
And to be honest, like everyone here is just following your news because there's nothing particularly spicy going on here at the moment. I mean, people are refusing to download the app. That's about as angry. And it's funny because everyone just accepted the sort of lockdown measures that, yeah, you can get fined $1,000 for sitting on a park bench or being on the beach without exercising, and the police can stop you. Like all of that sort of really heavy government stuff. Everyone's like, yeah, that's fair enough. But as soon as the government's like, we've made this app, would you download it, please? People are like, oh, I'm not downloading that. That's it. This is a free country. I'm not going to download the app. But yeah, no, I think we're a lot more compliant generally than the Americans seem to feel, some of them, that like it gives them a real sense of purpose to get out on the street with their automatic weapons and stand up for freedom, even if it looks to the rest of the world like they're extremely misguided individuals.
Well, for what it's worth, a lot of us here also think that they are extremely misguided individuals.
Yeah, I can imagine. I mean, even here in Malaysia, like there's no protest or anything, but people are concerned more in terms of like businesses, in terms of some businesses really operate through face-to-face, and with them, a lot of them shutting down their businesses, it's really affecting them. And just like just now I mentioned about moving to digital, a lot of companies now are forced to move into digital because they have no choice. And it's something that everyone's very concerned about, the general economy and sustaining their business in general.
Yeah, that actually brings up a really good point. This is a little, I guess, off the cuff question, but I've seen a lot about how companies have been able to adapt very quickly to working from home and digital workspaces, where they've denied a lot of people with disabilities that access in the past. And I'm wondering now if you think this will be good for us. They'll be like, we have made accommodations, we know we can do it, or they'll be like, nope, sorry, we're all back in the office now, deal with it.
Yeah, I think this is a real opportunity for optimism for people with IBD. I mean, I certainly remember when my Crohn's was active and I was working, I had to get up in the morning and kind of be at a job at a particular time, how incredibly stressful that commute was, and how I knew where all the toilets were. And I knew, look, by this point, I'm going to need to run to this toilet and then this toilet. And then, if that toilet is closed for cleaning that day, it's a massive panic and you've got to have backup toilets. And to think, yeah, the whole time you could have been working from home. I mean, I think this has been something of a revelation. And the same thing about telehealth. I mean, so many doctor's visits really are just going, look, I need another script for this. And or just having a chat, and to think that you could do that, they could send you the script or even send you the medication without you having to leave the house. I think this has set a lot of precedents, and I hope we can continue with all of the good ones.
I totally agree. When I was first diagnosed with colitis, I was still working full-time out of the house, and the commute to and from work was always very stressful. And I maintained, like, one of my most proudest moments, I think, as an IBD patient is I got a scope on my lunch break and returned back to work.
Wow.
Imagine not having to do that. Now I work from home, I work for myself, and I'm so much healthier than I was then, but I think about how it could have been different. And my job, like, I could have worked from home. I absolutely could have done my job from home, but it was, I think at least then, that this was 2009, I think people were scared to let their employee, I think they still are scared to let their employees work from home, but when you're forced to, and you can see that the world continues, the business continues, I would argue people are even more productive. I hope that produces massive change for people, specifically with in the disability community, but especially I think those of us with invisible illnesses, because it's so hard to be taken seriously sometimes at your job when you look fine, but you feel like garbage. And you're like, I'd really like to go home, but no one's gonna. Have you ever pretended, like coughed, just to be like, I'm so sick, I have this cold, I gotta go home? Because it's much easier to explain a fake cough than like, actually, I'm going to the bathroom 10 times a day while I'm at work and it's awful. I don't know. I hope that this induces like a massive change of work from home policies, but I feel like I'll have to hold my breath on that one.
I really hope it does. Like, even for myself, like when I was first diagnosed, I made a decision to actually like leave my corporate job. Like, I've been working for about 10 years. So I took that experience and decided to go off on my own and, pick the times that I wanted to work and, be able to work from home, which helped so much because at the time, when you're first diagnosed, you need to go a lot for checkups, you need to go so much of hospital visits and things like that. So I was able to fit all of that in while still working. So I have been working from home, like, throughout this whole like 3 years, and, going into the office whenever needed. And so I think that flexibility actually makes me more productive and being able to take care of my health, which for me is the most important thing, because it's so easy for us to actually like go into a flare or things, and things are so unpredictable. So at least in that sense, if we are able to draw a balance in terms of like how we want to work or the choices that we take when we want to take on a workload, so that is actually on us. So, and for me, when I do that, make that decision, my health is like the number one priority. And that never used to be the case. Like before I was diagnosed, I didn't really care about anything. I think that, oh, I'm healthy, I can go on for whatever time and things like that. But now there are so many boundaries that I draw, and I'm so much more conscious in terms of what I do. So, and in that way, having UC has given me a total mindset change throughout this whole time.
Same, girl, same. Well, and so that actually brings up it's a good segue, because working in the office is stressful and can cause anxiety and all of these bad negative feelings, which I think a lot of us are feeling right now in terms of relation to COVID-19. So how are you guys handling the stress right now? Like, how are you managing stress or fear or anxiety and making sure it doesn't send you into a flare? Anybody have any great tips on that? What about you, Aisha?
Well, I mean, it's not easy, to be honest, but just to keep sane, I end up talking to family, because my family is like in different parts of the world. So right now it's just me, my dad, and my brothers. So I keep in touch with the rest. We video call every day, and we just encourage each other to keep sane. But yeah, other than that, it's not like it's just something we've never thought we'd experience, really. Like, even going to the groceries, it's just I have this paranoia, like it's just always paranoid and anxious, like you just want it to go back to normal, but is it ever really gonna go back to normal?
Yeah. I feel so. Before all of this, my husband loves to cook, and he would go to the grocery store literally every day. And I hate the grocery store, but he loves it there. And now, when you run out of something, it's such a big deal to go get it that you just don't. You just go without.
Exactly. I'm someone, sorry.
No, go ahead.
So I enjoy cooking too, and for me, it's like when we need something, we just go and grab it, you know, like because the supermarket's like really close by, and it's something we do. Like, oh, okay, today I'm gonna cook this. I'm just gonna go run and grab it. And now you have to like really think twice and see what you have and just work with what you have until it's like really necessary for you to actually go there and get it. It's frustrating.
Yeah, I feel that. Luke, do you have any great Zen tips? You have access to a great beach, so that almost feels unfair. But does that help?
Yeah, it's totally unfair. I have one of the most beautiful beaches in the world, 10 minutes walk away. So like I go every day, and the weather, you know, as you may know, we had just 6 months of biblical weather in Australia. We had terrible fires that we didn't see blue sky for at least 3 months. It didn't rain for 6 months. And then when the rain finally came, it was a deluge, floods that went on for weeks and lightning storms, and our house was flooded. So after all of that, suddenly for the last 4 weeks, we've had the most perfect weather here in Sydney. Absolutely gorgeous blue sky, perfect temperature, you know, warm enough for you to go to the beach and swim, but you don't have to put on, you know, sunscreen particularly because it's not, you know, it's just been absolutely perfect. The ocean's been clear. So that's helped enormously. And I realized that my well-being is intimately connected with the weather. So those days where we were waking up and it was, you could smell, it was like, smelt like the house was on fire and you couldn't see the sun, you couldn't see the stars at night. That was a lot more distressing. The other thing is though, I mean, I've been housebound for 2.5 years of my life, a couple of times because of IBD. So I'm very used to being at home and I'm not sick at the moment. So it's felt mostly like a holiday. The thing that's been difficult to deal with because all my work disappeared was just this sort of nagging sense of futility about the day. I felt a little bit like I'm an actor and I've been put in a scene, but I don't know what my motivation is. And I don't want anyone else's idea of what my motivation should be. I don't want to be told what I should be doing. So my main thing is just focus on the present and live in the moment. And the biggest thing is just try to go as long as possible each day before you look at your phone. Because as soon as you do that, it just kind of sucks you in. It's like a Dementor from Harry Potter. It just kind of your face goes into it and you end up just going down these bad rabbit holes and obsessing. So the longer you can tune out of that or just use it to connect with family or just use it for positive things, the better.
It does feel a little bit like we've kind of been preparing for this our whole lives as IBD patients. Because you're the same. I'm like, I'm fine being at home. I have been stuck at home many times. And I really only went 1 or 2 places anyway. So like, this is not that bad. But for the rest of the world, I can see how this would be very difficult. But I feel like IBD patients, we're like, we got this. This is not so bad.
So true.
So we're getting close to the end here, and we've talked a little bit about you know, what we think this is going to look like when it's over. And I feel obligated and also kind of interested to end on a real positive note, which is
Can I ask a question to all of, just very quickly before you ask it, Jackie? Did any of the rest of you have people hoarding all the toilet paper? Because that felt like the most direct assault on people's ideas. As soon as any lockdown started, some idiots went out and bought all the toilet paper, and I don't understand it. Did that happen?
No, that's what I've been hearing a lot from Australia, actually, but not here.
Didn't happen there?
Not here either, not in Saudi Arabia. That's the last thing that ran out.
Right, Estonia?
Yeah, in Estonia, the first days we had this panic, but it wasn't that the paper was running out, but they couldn't manage to transport it to the shops. This was the panic. They saw there's no paper and everyone ran to buy even more, but it was just a matter of the transportation problem.
Right.
But
so it was
other
just
than
the
that,
US and Australia, right? They had this really big toilet paper hoarding thing.
Europe too, but it's been so weird. And to your point, we waited like 2 weeks before we bought more toilet paper. We didn't need it, but I was also like, you know, I have IBD. If anybody should be panicking about toilet paper, it's me. And if I'm fine, you're all crazy. But we have a bidet too, so I was like, whatever, knock yourself out with all your toilet paper.
You have options.
Yeah.
Exactly. Yeah.
Okay, so final question. We talked a little bit about, you know, what we think will happen or what will come from this. And I want to ask you guys, what do we think will come out of this in terms of good stuff, specifically for patients? So maybe it is working from home or, you know, televisits. Maybe it's a greater understanding of social isolation due to illness, you know. I think that there's a lot of room for improvement on the world at this point and how we handle all of this stuff. But, you know, if you had to pick one or two things, what would be your silver lining for coronavirus? I'll give you a minute and then I'm gonna call you out. I think for me personally, it's definitely the understanding of like flexibility of work from home. Like I said, I work from home now, so I do whatever I want, but before, how different my life would have been had that been more of an option, and how much easier things could have been. And I also just hope in general, I think selfishly, I hope some of this distancing stays. Like I said, I don't really want to hide. I'm not a hugger. Actually, I just got this really great shirt. My high school German teacher sent me this shirt.
Nice.
So I would prefer to stop touching other people. So maybe that'll stick around. Yannick, what do you hope for?
Probably the online telemedicine will get popular. Also, the possibility that we can do the online conference, video calls. Also, the information page probably will be recorded and maybe online. But people have funny thing, they forget fast bad things. So probably in a month or 3, we live normal life and we don't even think back. And we, as the ban is lifted, we go crazy. We start living like we like the cows who is left in a spring to the out from the barn. We just go and do these things, and this is the most scary, because if the second wave is coming, we have to be extra careful.
Yeah,
and also the concerts, like someone already mentioned that in Estonia we don't have big concerts, but this is the what is the big concert? How many people is a small concert? Then they say 1,000 people is going up, then it's a big concert. So you can imagine everyone is doing under this, and so anyway, it's getting stressful anyway. Any day, if the ban is lifted, you never know what's going to be tomorrow's news. But we still come out of this and be stronger.
What about you, Aisha? What do you hope for? What's your silver lining?
Well, I mean, I really hope this whole telehealth continues. I mean, I enjoy the whole staying at home and contacting the doctor when you need to, and the fact that your medications are delivered to you, and you don't have to go to the hospital just to pick up medications. But yeah, I mean, other than that, I hope there's good that comes out of all of this, really. Like, I think we're all being prepared mentally if anything in the future ever happens, like similar, like we know how to handle it, and we know how to handle the situation, and not to panic, really.
Yeah. If you could tell future world something, it would be just don't panic, like calm down.
Don't panic. Yeah.
Luke, what do you hope for?
Yeah, I think what Aisha said there about how she's able to see a specialist in the States now. I mean, that's really quite mind-blowing to me. That one of the big problems with IBD in Australia is that if you live in a rural or remote area, and we're a big country, but everyone's pretty much concentrated in a handful of cities around the coast. But if you live a long way out, it's very hard for you to see a gastroenterologist. There's huge areas that aren't covered. So the idea that because of this, it's actually forcing doctors to learn how to use Zoom. Because I mean, so many gastros and doctors, either they don't have the time or the inclination to learn how to use this technology, but they've had to now.
Yeah.
And I think it's going to be great it's going to give so many more people access. And I also like what you said about empathy. I do think this is a great opportunity for people just to understand what it feels like to just lose control of your life because of an illness, to just realize, okay, all the dates are wiped off the calendar, can't go out, this can't happen. Everyone's experienced that mindset now. So it's a great opportunity for empathy and storytelling. The government's handed out a bunch of support measures because of an illness to people who are losing work. So again, that's setting precedents that as IBD advocates, you know, we can use those to advocate for better conditions in the future.
Oh, that just made me feel super inspired. I was like, yes, yes, we can. We can totally use these. Melania, what do you hope for?
I think more than anything, I feel that this whole, quarantine has brought up a lot of debate on mental health. And there's been a lot of conversations on that. And, whether it being the government, in Malaysia, the government has, given free access to certain, mental health. They have like telehealth for, for someone to talk to what you're going through. So, and also in terms of even organizations, they are, starting to take care a lot of their workers, mental health being, and that's so important. And, just like you said, for us, it's something that we constantly work on, that we are going through and having an invisible illness, especially like for myself, like when I have a flare, that's when I really am at a state where I need to really work on my mental health, because it's a lot of ups and downs and ups and downs, and you think you're better but you're not, and things like that. And so I think awareness overall, and just like what Luke shared about what IBD patients can do, actually, because a lot of conversation has been talking about a new normal. And for us as IBD patients, we've been going through a new normal ever since we've been diagnosed. We have to relearn certain things, we have to do things differently. And it's a lot about what people are going through now, either staying at home. And, what we have been doing is, if we are at a period where we're not feeling so well, we have to stay at home, so we can probably also teach other people in terms of how they can embrace this period of uncertainty, because as ourselves, we are working with uncertainty every single day. So yeah, those are a few of the things that I hope.
Well, I have to tell you guys, there is honestly nothing I would have rather done at 3 a.m. than talk to you. It has been such a joy learning about you and what's happening with you. And I'm so glad that we got to do this. And I hope, if nothing else, at the other side of this, we continue to stay more connected internationally, because it's been so interesting learning about you and your countries, and everybody on the last call too. That, I mean, that's 8 different countries that I've learned about in the last 2 weeks. And it's kind of astonishing, like how different things are, and yet how connected, and how we can all still relate on the same level. It's been really, really cool. So thank you for coming. Thank you to Galley Health for hosting this again. I feel like this is such a cool job that I get to have. And it's been really, really nice getting to know you. So I hope that you keep in touch, and hopefully we will get out of this soon. And if not, we'll do it again. We'll see you again, right? We'll just keep talking about it. But until then, we will see you guys later, and have a good day, night, wherever you are, have a good one of those.
Bye, everyone.
Thank
Bye-bye.
you. Bye, Jackie.
Bye.
Thanks. Bye, guys.
You're going to go back to sleep, Jackie?